Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemi because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.
Hello, everyone, and welcome to a fresh episode of Ask the Pediatricians Hour. I am Gbemisola Boyede. I'm a pediatrician, and I'm your anchor for today's broadcast. Thank you so much for joining us on whichever platform you're listening or watching me today. Thank you to those of you joining us from Facebook, from YouTube, and from Instagram. And for those who are listening on Fresh Waves Radio, as well as our podcasts, Ask Dr. Gbemi Atp Podcast platform, I want to say thank you so much for joining us today. And if today's your first time, we especially want to welcome you. Ask the Pediatricians Hour is a program devoted to providing health education and information about important health issues that affect our children. And we have this program every Thursday, 10 a.m. West African time. But you can always listen to past episodes on the same platform you're listening to now or you're watching on. So if you want to watch all the episodes we've had this year so far, you can go back to the podcast or our Facebook page or our YouTube channel or our Instagram TV channel as well. So just look out for our links, which is showing on the screen, and you can always watch previous episodes. And if you have any questions on today's topic or past topics that we've handled on this program, you can ask your questions by going to Ask the Pediatricians Facebook group from Mondays to Saturdays, and you can put your questions there, and we will try our best to approve them, and we will also answer them. And you can also email us on askthepediatricians@gmail.com as well, and we'll try and answer your questions as soon as we can. So thank you so much for joining us today. And today I'm going to be talking about ear infections. This year I've decided that we should be talking about common things, like we used to say in medicine, common things occur commonly. So it is important for us to know about these common issues that as parents, as caregivers of children, we tend to face every day. And as you can see, for those who are watching, those who are listening, we are seeing it on the flyer. Today we're talking about ear infections. I mean, these are some of the most common infections in children. So it's important for us as parents to know what they are, how they happen, what causes them, what are the symptoms that will help you to know that this may be ear infections, and then how do we treat it, and how do we, more importantly, like we always like to do on ATP, how do we prevent, because we really emphasize a lot on prevention. So that's what we're going to be talking about today. However, before we go into the main topic itself, I would like to show you a picture for those who are watching. For those who are listening, just use your imagination. So this is a picture of our hair, and we have two hairs, but most of us need to know that that part that we can see, that's not all that is to the hair. We actually have three parts to the hair. We have what we call the outer hair, we have the middle hair, and we have the inner hairs. So the outer hair is that flap of cartilage that we can see outside. That is the part that most of us we touch. That's the part where we put earrings and stuff like that. So that is the outer hair, and it leads into a long canal. We call it hair canal. Some of us, if you put your finger, or for those of us who like to put cotton ball, that thing, that long space where you put that thing, that is the hair canal. Okay, and all those with the part outside and that hair canal constitutes what we call the external hair or the outer hair. And there's a membrane, we call it tympanic membrane. If your doctor is looking at your child's hair, we can actually see that membrane with our otoscope, and that membrane separates the outer hair from the inner hair, the middle hair. So the middle hair is the parts where we have some bones, some small bones that kind of amplify sounds. They are the one present in the middle hair. And after that, inside, very close to the brain, we have the inner hair, which is where you have what we call the semicircular canals and the nerve, the auditory nerve that actually make us to be able to hear, and which now gets connected to the brain. That is where you have that. You have the cochlea and all that. So that is the inner ear. So most of the time when we're talking about hair infections, it tends to be limited to the external hair and the middle hair. Most of the time for the external hair, we often can see it. You can see either the wound or the pulse, on the external hair, the outer hair that we've talked about. And that we tend to call it otitis externa. However, most of the time when we tend to use the word hair infection, we're often talking about the one in the middle hair. So that is, sometimes we call it otitis media. So we're talking about infection of the middle hair, because that you may not be able to see it unless this membrane, or the hair drum as we call it, has ruptured, and then the pores are coming out into the external hair, and then you can see it. Otherwise, most of the time you won't see it. You may see a bulge, but you won't be able to know what is going on inside. So I hope I've been able to refresh your memory of the anatomy of the hair, because it's so important for us to know that even though I'm going to be talking about hair infections, and hair infection can affect the outer hair, that's the part you can see, but it can also affect the, mostly when we talk about hair infections, we're actually referring to the infection in that middle part of the hair. So those are the areas that we are going to be talking about, so that we can understand what we're talking about. So let's talk about hair infection. What is an ear infection? I guess that is very simple, and I think I've tried to, even in my anatomy, I've kind of alluded to what we meant by ear infection. So ear infection basically means there's multiplication of germs in a particular part of the body. So last week I talked about urinary tract infection, and that is multiplication of germs in the urinary tract. So when we're talking about infection, we're talking about changes that occur due to multiplication of germs, usually most of the time bacteria, in the part of the hair affected. If it is the outer hair, we call it otitis externa. If it is the inner hair, we call it otitis media, the middle hair infection. And anyone can get hair infection, but of course it tends to affect children more. And obviously at one point or the other, every child may have had an ear infection. And like I said, for the otitis externa, it's very easy for us to know, because we can see what look like wound or pores or something on the outer hair. Whereas for the otitis media, most time we cannot see anything, because the multiplication of the germs and the buildup of water fluid or pus, they are behind the hair drum. So they can make it to bulge, but you won't be able to say, but they are behind the hair drum. So that is what we meant by hair infection. and most times it's very common in children, very, very common. In fact, at every point in time, 5 out of 6 children would have had at least one ear infection by the time they are 3 years old. So it is one of the most common reasons why parents come to the doctors, especially towards the pediatricians. So ear infection is one of the most common reason for presentation at the pediatrician's clinic, or even to the general doctors. So it is very important for us to know about it. And like I said, the medical jargon for it, we call it otitis media, but you can also just say hair infection. Now, the next question is, what are the symptoms? How do you know if your child is having hair infection? So the symptoms you will see depending on which part of the hair is having the infection. So like I said, this is the external hair, I guess we tend to see it. And even for the middle hair, the middle hair, there are different types of infection that can even happen in the middle hair. You can have what we call the acute otitis media. When we use the word acute in medicine, we are talking about something that is happens suddenly, something that's just happened over a few hours or a day of days. So it's just something that just happened now. So it's acute, and that's the most common one. So when we talk about hair infection for the very first time, most of the time it is just acute otitis media, and it is the most common part of it. And in this one, there's a lot of concentration of germs, and there's water that is trapped behind the eardrum, and so the child will tend to complain of hair pain, and my hair, I'm having pain, and of course the children may also have fever. Those are the symptoms you see with the acute otitis media. Now, sometimes you can also have this otitis media with what we call effusion, and this tends to happen when, if the acute one is not quickly dealt with, and then there's water that is trapped behind the eardrum. And so we doctors will be able to see it with our otoscope, that special instrument that doctors used to put in our children's ears when we go to the hospital. And that is the otitis media with effusion. You can also have what we call the chronic otitis media. So when we say chronic in medicine, we're talking about something that's been going on for a long time. So we're talking about in chronic otitis media, it is the infection has happened over and over again, and the water is just kind of permanently remaining in the hair. And even when there's no infection, there's a lot of water in the hair, or sometimes people tend to call it blue hair. And sometimes it can affect the children's ability to hear. So those are the different types of otitis media, but you as parents may not need to worry yourself about that. But the reason why it's important is that it determines how we can the management for it, which we will talk about when we talk about how do we treat ear infections. So how do you know when your child has ear infection? I think that's what most parents want to know. In very young children, what they tend to do is that they tend to pull on their ears. So once you see your children who appears to be ill, who appears not to be feeling well, they are always pulling on the hair as if, and most parents, what I'm talking about. You're like, what is wrong with this hair? Why is the child pulling on the hair? It could be a symptom or a sign of ear infection, or sometimes the children are just fussy, they are just not comfortable, and they are having pain, because the toddlers, especially our pre-verbal children who are not yet talking, they just cry and cry and cry, and then they may be pulling on their hair. So you see a child who is crying, a toddler who is crying, who is pulling on their hair, that may be a sign of ear infection. Also, they may have fever. So usually most infections tend to come with fever, and sometimes for the older children, they may not have fever, but the younger ones tend to have fever. So they have fever, they are pulling on their hairs, they are fussy, they are crying, or they are not able to sleep, you have to start thinking, oh, is there an ear infection going on? For the older children, they're able to tell you. They're able to tell you, my hair is paining me. I can feel, or I'm having an hair ache. So you're able to quickly narrow it down. But for the younger ones who are not able to talk, they may not be able to talk, but their actions through pulling on the hairs, the fever, the fussiness, the crying may alert you to the fact that they are having hair infection. And sometimes you can see, if the infection has caused kind of rupture the eardrum, you can actually see the pulse coming out. And sometimes this is why most parents even notice that my baby's ear is bringing a discharge. There's ear discharge, there's water, or there's pulse coming out. And that may be another sign. Of course, usually when children have ear infection, there's a lot of water, a lot of buildup of fluid behind the eardrum. So they may have trouble hearing. So you're calling them or trying to talk to them, and they can't hear you, or they're telling you need to put on the TV louder, or they can't hear even though you are standing right next to them talking to them. It may be a sign of infection as well, and also because the hair is not just the organ for hearing, for us to appreciate the sounds that people are passing across to us. It's also our organ of balance. This is the head. We have what we call the vestibular canal. They are inside the inner ear. They are actually part of the inner ear, as I was showing us earlier, and they are responsible for making sure that we know where we are, how we're balanced. So when you shift yourself, they will help you to get back to the normal posture, so you are aware where you are. So it's the organ of balance. So when children have problem in the inner ears, or hair infection in the middle, which can affect the inner ears as well, they may have problem with the balancing. And they feel as if they are dizzy, as if they're going to fall. So those are the signs that we may sometimes see in children when they have ear infection. So it's very easy most time for parents to be able to figure out that their children have ear infection, especially for the older children. They're having fever, they're complaining of ear pain, ear ache. You can see pus coming out of their hair. I mean, it's very easy. For the younger infants, sometimes you need to be more suspicious, so you have to be watching. But most of them also pull on their hairs as well, or you may see the discharge coming from their hairs, so you may suspect it. I really need to pause at this point to say there's a difference between earwax and the pus that we see in children who have infection, because sometimes parents are not always sure. And a lot of parents sometimes think, oh, there's discharge coming out, whereas just wax. So the wax tends to be more brownish. It tends to be thick, and it can be darker sometimes depending on how long it has been there, so we can see that you see it build up. Whereas pus tend to be yellowish, it can be greenish, can be whitish, and in addition to the discharge, that you can see other symptoms, the fever, the pain, and all that. Another signs which doctors sometimes do that, even for children who are not pulling on their hairs, when you pull their hair, which you see doctors do that sometimes when you go to the hospital, the children will have pain. So even if the child is not complaining of pain before, or you will notice that anytime, actually for very observant parents, you notice that anytime they are playing with their children, their hands go to that, the child kind of wins and shows that the child is in pain. Again, that may be another sign or symptom of ear infection, even for children who are not even complaining earlier. So those are the symptoms. So it's very easy for us most of the time to know. But sometimes, just like in many other infections in children, sometimes they may not be very clear. They may just have fever, those fussiness, and we as the doctors have now to figure out where is this infection coming on. And that is when you go to the hospital, you see us trying to look in the ears. Even when you have not complaining of ear pain or anything, we still look with our otoscope or horoscope, depending on which one you want to call it. We look, so there's that kind of like a torchlight that the doctor puts in the child's ears. We look again, just because sometimes you may not, the child may not have expressed those symptoms of hair pain, hair ache, or hair, there may not be any discharge, but the child is having fever, and we're trying to figure out what is causing this fever, the infection. One of the places we always look is in the hairs. I talked to us last week about checking the urine as well. So we always do urinalysis just to make sure there's no urinary tract infection. Another thing we should not forget to check is the ears. Another thing we should not forget to check is the throat, but maybe I'll talk about throat infection at that time. All right. So what causes infection? Just like we said earlier, it is germs, but usually for the ear infection, it is mostly bacteria. Sometimes it can be other organisms like viruses, even fungi. They can also cause ear infection, but majority of the time they are due to bacterial infections, and there are different kind of bacteria organisms that can cause the infection. We have different types of them. I don't want to go into naming them, but you have things like the Streptococcus bacteria, the Haemophilus influenza type B bacteria. Those are the kind of common bacteria that are that can cause ear infections in children. You will know why I'm mentioning some of those things, because luckily for us, we have some vaccines against some of these organisms that can cause ear infection. So also, if children have other infection, because the respiratory tracts, they kind of link together. So the ears, the throat, the nose, they kind of open into the same pathway. So sometimes an infection may start from somewhere else and end up in the hair. So it may start from the throat and it can migrate to the hair, or it can start from the nose and get to the hair, because they are kind of linked together. So that is, or it may even be a different thing, like a virus causing infection in the throat, in the nose, and then when it gets to the common area of location, then it can end up, tracking to the hair. So that is how children are predisposed to ear infections. And there are many reasons why children, compared to adults, I hope we have noticed that children tend to have ear infections more than adults. I'm sure most of us cannot remember when last we have ear infections as adults, but our children tend to have certain reasons. If we go back to the anatomy, which I showed us earlier, let me see whether I can put up the picture again. There is the tube in the ear that's that the children have. This, we call it eustachian tube, which is like the drain, so anything coming to the air, excess water, excess, they kind of go out through this eustachian tube. Don't worry so much about the medical jargon, but just for you to know that in children, those tubes are smaller compared to adults. So it's make it more difficult, and it's making it more difficult for water or anything gets into the ears in children to drain out compared to that of adults. So, and that is, once you have water staying, which is one of the things we always emphasize, keep the hairs of children dry, keep it dry, because if water enters into the hairs, it's more difficult to get rid of it. And once the water stay longer, it is easier for germs to, stay, and then they can have ear infections. Also, when children have colds, children are prone to having viral infections causing, catarrh, cough, and all those things. The eustachian tube gets swollen, and when it gets swollen, it gets more difficult for it to actually do its work of draining out water. So it makes it easier for infection again to happen within the ears. Also, children immune system are not as effective. It's still developing. The children are still learning how to fight these infections as they're getting exposed to them, whereas adults have had many years of practice. They've developed lots of antibodies and immunity against some of these infections, whereas for children it is not as effective. So children tend to have infections more than adults, and also especially within the ears. And also children have what we call adenoids. We all have adenoids, but in children it tends to be very big, and sometimes the adenoid can also trap bacteria, germs, and that will cause chronic infections because it's closer to the area where the tubes, like I told us, all the organs, the ear, the nose, and the throat, they are kind of connected together. So infection from one area can tend to spread to the others. So these are the reason why children are prone to having ear infections more than adults. All right. So for those who are just joining us, welcome. We have been talking about ears and ear infections in children. I've just shown us an anatomy of the hair. We have the outer hair, the middle hair, and the inner hair. When we talk about hair infections, most of the time it's actually the middle hair, but you can also have external hair infections as well. And we're talking about the symptoms that you see: fever, hair pain, hair ache, hair discharge, trouble sleeping, and all that. Those are symptoms that children can have when they have hair infections, and hair infections are mostly caused by bacterial germs. Now, how do we as doctors make a diagnosis of hair infections? Again, hair infection is one of the easiest conditions for doctors to diagnose. So, number one, the symptoms are always obvious. So hair pain, hair ache, fever, we start to think of hair infections. And even when children don't complain of these symptoms, we also have a very good instrument that we can use. And you see that most of the time when you go to the pediatrician's office, they are always looking in the children's ears and throats because it is easy for us to see. There are changes that we'll see in the hairs where when we put the oroscope or otoscope into the hair, we want to see, whether there's anything happening behind the eardrum. Normally when you shine light on the eardrum, it will reflect light. It's supposed to be shining. So, but when there's infection, there's a lot of water or pus behind the eardrum, it looks dull, or it can be bulging. You can see that it looks red, it's bulging, sometimes it's already even ruptured, and you can actually see the pus, coming out of the ear. So this is what the doctor will see, and immediately we say that we are sure that this child has ear infection. So it's very easy for us to make a diagnosis of ear infection. And sometimes we can, if there's pus already coming out, we can take a swab. We put a little bit of that like a what do they call it? It's like a probe, something that has like a little control at the end of it, and we, like your cotton bud, but it's not a cotton bud, but something like that, where a stick or swab, where we can just take a little bit of that, whatever is coming out, and we can send it to the lab for them to test for us. But sometimes if there's no discharge, we don't need to do that. Once we see the fever, the symptoms, we can look into the ears, we can see the changes in the eardrum, then we are pretty comfortable to know that this child has ear infection. And of course, the treatment for ear infection is antibiotics. If it is most of the time, if it is like I said, most of them are caused by bacteria, and so what we normally do is to give antibiotics to the child, and depending on the kind of bacterial germ that we're suspecting, we also have an idea of the kind of antibiotics we can prescribe. And like I also told us last week, please let's make sure we complete the antibiotics treatment. Sometimes some ear infections are due to viruses and they are not due to bacterial germs. So sometimes the doctor may not want to give antibiotics. So because I know some parents always want to like, why is my child not given antibiotics? So if your child is suspected to have a viral cause to the ear infection, they may just say, let's watch. Actually, most of those children don't have fever, they may just have a little bit of hair pain and just give them paracetamol and they'll be fine. But if there's pain, there's fever, there's changes when they examine the hair, then the doctor will likely suspect it's a bacterial ear infection, and they're going to give your child antibiotics. So we tend to start with simple antibiotics, usually we start with something like amoxicillin, something very simple, and that's what we do. The reason why I'm saying that is I know a lot of parents, especially for those of us in Africa, where we have easy access to antibiotics. Some of us just go to the pharmacy or chemist shops, as we call them, and we just take all these antibiotics. And some of us go for the big guns, people start going for things like augmentin, like Synats. These are very strong, powerful antibiotics that we should not use anyhow. Reason is that if your child does not respond to the simple antibiotics, that is when we'll be going to those very powerful antibiotics. But if we use those powerful antibiotics indiscriminately, our children are likely going to develop what we call antibiotic resistance, and it may not even work for them, and that is more trouble, because then we now start looking for something more powerful, which means more expensive, which means not readily available to treat the infection. But so again, stressing the need that the fact that that, oh, it's an infection, or at least it's Dr. Gbemi, my child has all the symptoms, I should just go and buy the antibiotics. Please don't. Okay, let's be good steward of antibiotics in 2024. Don't just go buy antibiotics. You have to see a doctor. All antibiotics have to be prescribed. Okay, because number one, some children could be allergic to certain antibiotics. So some children have what we call penicillin allergy. So your doctor will not give you drugs that your child will likely react to. So these are important issues when it comes to drug, which is why as parents, we cannot just go and buy any drug by ourselves. We ask you those questions. We need to know. So if your child has penicillin allergy, we're not going to prescribe like amoxicillin, for example. So, and there's a way doctor will ask you questions, what drugs that your child reacted to before, and we will be able to work it out. So they know that this particular kind of antibiotics should be avoided in your child. Also, the dose of the antibiotics varies depending on the weight of the child, depending on the severity of the infection. That will determine how much of the antibiotics. Everything is not 5 meals 3 times a day or 5 meals twice a day. No, the dose depends on the weight of the child, and so that is why our doctors have to prescribe the antibiotics. We have to give it at the right dose for the right duration, and that's why some of us will go and use antibiotics indiscriminately, and then we'll say the child is not better. Number one, we may not have given the right antibiotics. Number two, we may not have given it at the right dose. Number three, we may not have given it for the right duration. So these are things. And of course, there are side effects of medication, and there are side effects that the doctor will tell you, okay, we'll just watch or we deal with it. Or there are side effects that we have to stop the medication immediately, like if a child is having an anaphylactic reaction, and they can die from that. So we have to know that is why it is not a good thing to just go to the pharmacy and buy antibiotics in places where our pharmacists, are very up to the tax. They will never give you antibiotics without a doctor prescription. And they also know that. So please, let's make sure that we don't buy antibiotics indiscriminately. Another thing that people tend to do is to go and put some hair drops into the children's hair. So no, don't put hair drops for hair infections unless a the doctor asks you to. So most of the time, the treatment is oral antibiotics. We give the drugs by mouth, not by ear drops. So in some instances, we use ear drop, but that is something most time the ENT doctors will be the one to tell you what to do. And another thing is, in terms of for the pain, I always recommend that we use paracetamol as much as possible. You can use paracetamol. Sometimes you can use ibuprofen. I actually am more comfortable with paracetamol for mothers because most time, sometimes when children are sick, they are not eating, and when you have to give ibuprofen, the child must eat. You cannot give ibuprofen on an empty tummy. Okay, so but paracetamol you can give it whether the child has eaten or not. So that's why I'm more comfortable with paracetamol for parents. But you can give paracetamol, you can give ibuprofen if the child is eating, but please don't give aspirin. Don't the so-called Fensic, Dagger, acetylsalicylate, depending on whatever name, different names, but the most common name, aspirin. Please do not give it to children, because when children have infections and you give them aspirin, they can have a very terrible reaction that we call Reye's syndrome. And with this Reye's syndrome, the liver just shuts down. They have what we call liver failure, and it's a very fatal illness. So we don't want that to happen. So please don't give children aspirin. Don't give children baby Fensic, whatever. Don't give them. Just give them paracetamol or give them ibuprofen. That's very, very important. So like I said, sometimes doctors, if the doctors are not sure whether the child is having bacterial hair infection, sometimes they may just not give any drug. They may just say, just wait and 2 days, 3 days, and see whether the hair pain will resolve and everything will go away, and just give ibuprofen for the hair pain. Sometimes that is all the children need. But if things are not better, or then the doctors may now start antibiotics, because sometimes it's not every ear pain in children that is actually ear infection. That is why it's not every time the children have ear pain that they necessarily have ear infection. And that is why sometimes if the doctors are not too sure there's actually an infection, they may just want to wait it out. So don't get upset with your doctors or your pediatrician for not giving you antibiotics. So they may just want to be very sure, so that we don't just give unnecessary antibiotics. So how long do we usually treat ear infection for? Most of them, usually within 5 days, they'll be fine. So most children will be fine and the infection will clear, but the water in the hair itself may stay there for a couple more weeks before it will clear. But most of the time the children will be fine. So, however, we have a group of children which I think most parents want to ask about. They have this ear infection over and over and over again. So it's like almost, I've seen parents told me my child's ear is never dry. The child is always having ear infection, So the question is, what happens if a child keeps having ear infection over and over again? So in such children, we will be suspecting that there are more to it, that there are other risk factors that is making the child to have recurrent ear infections. Just like any other infections, we are going to now start looking out for those risk factors for recurrent ear infection. And even starting from things like, where is this child? What's the environment? Are there people smoking? Because we've noticed that secondary smoking, which is what happens to children when they live around people who are smoking, is even worse. And those kind of children can have ear infections. Also, children who are on bottle feeding, which is one of the reasons we don't, as pediatricians, don't encourage bottle feeding. They're also prone to ear infections. Some children may have problems with their hair, with the hair drum itself, and they may have what we call glue hair, persistent hair fusion in the hairs, and sometimes the doctors may have to put in what we call grommets, like a tube, to kind of help them drain out the fluid in their hair. So sometimes we have to do that as well. If a child has adenoids, and that is why they are having recurrent infections, not only infections of the tonsils and the adenoid itself, but infection of the ears, we may consider doing what we call adenotensinectomy. That is taking away the adenoid and even the tonsils, because that may be the only way out. So usually for children who are having recurrent ear infections, those are the ones that need to go see the ENT. So for your first infection, ear infection, you don't have to go and see an ENT doctor, okay? You can see ENT doctors mean ear, nose, and throat surgeons or doctors. So those are the specialists when it comes to things that have to do with the ears, the throat, and the nose. So for children who have just 1 or 2 episodes of ear infections in a year, your pediatricians are good enough to treat you. Even your general practitioner, your family doctors, they will be able to handle that. But if the ear infection is coming over and over again, it's becoming recurrent, the hair is always discharging, those are the children that we want to have a specialist opinion from, about them, and we usually will refer them to the ear, nose, throat surgeons, so that they can do further evaluation and try to figure out why the recurrent ear infections, and then they will be able to deal with it. All right, I'm going towards the end now, which is the most important thing I like to talk about, and that is prevention, because the most important thing, pediatricians, we don't want to treat infections at all. We don't want to treat ear infection. We promote things that will not even allow it to happen in the first instance. So let's talk about prevention, because like the saying goes, prevention is always better, it's always cheaper than cure, and of course less painful for everyone and less stressful for us as pediatricians as well. So can we prevent ear infections? Absolutely yes. Ear infections can be prevented because, like I said, there are things that we can do to reduce. I'm not sure we can completely eliminate ear infections, but we can definitely reduce the numbers of ear infections that our children will have. The first thing we can do is vaccinate our children. So we have good, vaccines are very important. We pediatricians, we can talk about anything without talking about immunization. So immunization is one of the wonders of the world, all right? What it means is that children don't need to have some ear infections if they already have vaccines that protect them against those terrible germs, those terrible bacteria that can cause infection. So when I was talking about the bacteria that can cause ear infection, I mentioned Haemophilus influenza type B. We have a vaccine against that bacteria. The Haemophilus influenza type B vaccine is part of the Penta vaccine. So when you take your child for Penta at 6, 10 and 14 weeks, you are getting HIB, Haemophilus influenza type B vaccine, and it will protect the child against ear infections caused by Haemophilus influenza. We also have the pneumococcal vaccine. Pneumococcal bacteria is one of the most common bacteria implicated in ear infections, just like it's not only pneumonia, meningitis, it can also cause ear infections. And so we also have vaccine against that, and we have vaccine against about 13 serotypes. So we don't have vaccine against all the possible serotypes, because parents always ask, if my child has gotten this vaccine, how come my child still has an infection? How come my child still has pneumonia? The vaccine protect against these bacteria. There are different type of them. They have different what we call serotypes. So all of them can cause infections, but we don't have vaccine that covers everything. We have vaccine that covers the most terrible of them. So we have vaccine that cover 10, we have vaccine that covers 13. I think the one we give in Nigeria is the PCV 13. It covers up to 13 serotypes. So it will protect your child against infections caused by these 13 serotypes. But your child can still have infection from other ones that we don't have vaccine against. But at least if we can protect against the one we have vaccine for, I mean, most times the children at least will be significantly protected. Also, we have measles vaccine, which can protect against measles, which can also cause their infection. So immunization is very important in preventing infections. So immunization is not only just for pneumonia, meningitis. Most of those germs that cause these serious infections can also cause ear infection. So when we give our children immunization, then of course they will be protected against ear infection. Another thing we can do is to make sure, when you breastfeed our children, for the infants, we exclusive breastfeed them. Exclusive breastfeeding, one of the reasons why we promote and shout it loud and clear is because we know that children who are exclusive breastfed for the first 6 months of life are largely protected against infections. And one of those infections they are protected against is ear infections. So, and a lot of mothers will ask me whether breastfeeding their babies lying down can cause ear infection. I think we've addressed that under myths and facts in child health. Breastfeeding, lying down, sitting up, standing up does not cause ear infections. Okay, so some mothers are not very, the breastfeeding lying down is a skill that you need to know how to do. It's not everybody that know how to do it. That's really for new mothers. So there's a way you have to breastfeed your child lying down. If you don't do it properly and you put the breast milk, in the ears or in the nose, then your child, there'll be wetness of the hair. So which is one of, and remember what I told us about the eustachian tube, that in children it is not the way it is angled and the way it is short. It doesn't allow you to quickly clear any extra fluid. And when there's wetness, that is a good breathing ground for germs and bacteria, and that's what causes infection. So it is not the breastfeeding, it is the poor technique that is causing that. So I always tell mothers, if you're not sure how to breastfeed lying down, just sit up and breastfeed lying down. But the breastfeeding itself, lying down, is not what is causing the ear infection. And if you are very good with it, you can breastfeed your baby lying down and your baby will be fine and not have ear infection. So let's make sure we exclusively breastfeed our babies and breastfeed them for as long as we can. It's one of the ways to prevent ear infections. Another thing is to make sure we keep the ears dry. Okay, I always teach mothers how to bath their babies. Please don't just pour water all over children, because they are not able to, regulate that. And most of them, will start either aspirating the water and all that. So so it's best not to just pour water all over their head, especially for the toddlers and infants. It's better to just wipe their face, wash their hair backwards and dry it immediately, so that and there are some kind of things that people sell now, like caps that you can put on children's hair, so that water does not enter the hair of the children. That's the goal. We don't want water entering the hairs because it's not easy to drain it off, and when the hairs are wet, it makes it easier for germs to multiply. And so we want to keep the hairs dry, but please don't go putting what's it called, a cotton board or whatever. Don't put it in the children's ear, because like I showed us in that picture, there's the hair drum is just a very thin membrane. So when you put all those cotton board and all those things in the hair, you can puncture the eardrum, and that is, you have not even opened the gateway for everything to go into the middle hair and the inner hair, and that's a dangerous thing. It also affects the child's hearing. So please don't put cotton bud in the children's ears. If you want to clean your children's ear, you can use your normal handkerchief. You can fold it into to form a tip, and then you gently, use it to clean out. So it's something soft. It's not going to puncture anything. Unlike the hair, the cotton ball most of us use is kind of pointed, even though there's cotton wool at the end. Sometimes when you are doing it, some of us even use matchstick, broomstick, what's it called again? Matchstick and all that. That's very dangerous. Even keys and all that. Don't put all those things in children's ears. Just use something like cloth that is folded to wick, and you just need to clean the external hair. You don't need to go in and in the inner hair. The hair is self-cleansing. That wax is the hair cleaning itself, and then when it is building up, it will flow out. But occasionally it can become too dry and then kind of find it difficult to come out. What you need to do is just put olive oil, 1 drop of olive oil in the both hairs for a couple of days. It will soften the wax, and then it will flow out. And when it flow out, you just clean it. That's all you need to do. So let's not be putting cotton bud and all sorts of things in our children here. Also, no smoking around children. Cigarette smoking. The smoke tends to destroy. There are some what we call cilia. There are some things on the surfaces of the respiratory tract areas, the ears, the throats, and all those places. And what those small, tiny, they look like broom, like cilia do, is to kind of sweep away bacterial germs and stuff like that, so they don't tend to settle on the surfaces of the inner hairs and stuff. So, but if cigarette smoking destroy their job, it destroy that work. So it make it easier for germs to penetrate into the lining of the respiratory tract, including the hairs, and that can now lead to infection. So babies around smokers tend to have ear infection. So if you're a mother, a father, you have children in your house, please don't smoke. Don't smoke near them. Okay? And it's not just even cigarette smoke, even the smoke from our generators, smoke from our kitchen, cooking, how the oil frying. Please, let's keep children away from smoke generally. Let's not put bottles in the mouth of our children to sleep. So some people want their children to sleep, they put them to bed, and then they now put a bottle in their mouth. Very dangerous thing, because it's easier for the fluids to run the wrong way and go into the hairs, causing it to get infection. And then when our children are sick, let's keep them at home. Let's not take them to crèche or school, because when they have ear infections and you take them to school, they expose other children, and then they too now becomes a vicious cycle. So these are the things we can do to prevent ear infections. All right, so thank you so much for those of you who have listened to me. I've been talking about ear infection, what causes them, what are the symptoms, and how do we diagnose them, how do we treat them, but more importantly, how do we prevent them. So if you have any questions about hair infections, feel free to go to our Facebook group. If you have not joined our Facebook group and you're on Facebook, then you are not on Facebook. Okay, all right, so you need to join ATP on Facebook. Ask the pediatricians. You can't miss it. Make sure you join the group, and then you can post your questions on our group Mondays to Saturdays, and give us a little bit of time, 24 hours, 48 hours. We'll try and answer your questions. And if you want to read more, you can also go to our website, www.askthepediatricians.com. We have lots of topics like this that we've handled that you can read to know more. All right. If your child has not been fully immunized, it's an opportunity for you to go take your children for immunization. Remember that immunization also protects your children against ear infection. So thank you so much for listening to me today, and I look forward to seeing you next week, when I'll be talking about another important topic that has to do with the health of our children. But before then, I look forward to reading from you, looking at your questions and answering them. You can also email us, askthepediatricians@gmail.com. Thank you so much for listening, and have a beautiful day. And remember to keep our children's ears dry and free from infections always. Bye.
Are you a mother, father or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemi because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.